Sri Sathya Sai Divya Katha, Sri Sathya Sai Divya Katha, Sri Sathya Sai Divya Katha.
Bhagawan Sri Sathya Sai Baba's approach to healthcare emphasized universal, free, and comprehensive care that integrates the body, mind, and spirit, believing that health is the root of all human endeavors. His teachings aim to promote preventive care through hygiene and healthy living, compassionate and loving service from healthcare providers, the establishment of hospitals and clinics that provide free, high-quality treatment to all, irrespective of their social or economic status. Bhagawan stressed that healthcare is a human right and must be available to everyone free of charge, particularly for the poor and needy. Ideal healthcare treats the whole person, encompassing the physical body, the mind, and the spirit, rather than focusing solely on bodily ailments. Education in hygiene, healthy living, and preventive practices is crucial to prevent illness and maintain well-being. The principles of truth, right action, peace, love, and non-violence, Satya, Dharma, Shanti, Prema, and Ahimsa are integral to the practice of healthcare. Sri Madhusudan recalls, it was on July 11, 2011 that Bhagawan mentioned for the very first time that he was going to build many schools and specialty hospitals throughout the country in the next 10 years. He said he would bring the right people at the right time to do it. He had a master plan, and all we needed to do was to simply follow without our heads interfering with it. Bhagawan's healthcare missions are implemented through hospitals and clinics, community-based outreach, telemedicine, training and education. Under the divine tenet of love all, serve all, Sai Sanjeevani began its journey into the uncharted area of congenital heart disease as a singular hospital in the country providing exclusive pediatric cardiac care totally free of cost.
Handsome is as handsome does. When somebody referred this to Baba, he said he would love to be remembered as love is that love does. Sri Sathya Sai Sanjeevani is that institution of service which cares for the sick, the poor and the downtrodden by providing them the much needed health for their well-being, sustenance and progress. The curing of an ailing heart was an act of service that Swami incessantly engaged in all his life. Curing of a heart of a little child is amongst the most compassionate acts of a human being. Sri Sathya Sai Baba, all his life, lived to heal, to cure and work for the welfare of beings.
When Sri C. Srinivas met Bhagawan, an astounding conversation took place. Baba mentioned to him that, though he was planning to open a hospital in Delhi, it was not going to happen immediately. Instead, a hospital needed to be built in Raipur first. Before Baba left, he instructed Sri Srinivas that he would come and speak to him further. This laid the foundation of the Raipur hospital, which was to be named Sri Sathya Sai Sanjeevani and was to be designed in the shape of a heart. Baba wanted this to start within a year and commanded that Mr. Srinivas meet the Chief Minister and secure the needed land for the same at the earliest, so that the groundbreaking ceremony could be done well in time for his 86th birthday in November 2011. Over the next 2 weeks, quick plans were made and presented to the government of Chhattisgarh. The rest is history. When Sri Srinivas went to the Chief Minister's office, the officials along with Sri Srinivas went to look at the parcels of available lands at the upcoming capital city. The first piece shown to them was totally opposite side to the place indicated by Baba. It was a mismatch. They were taken to the other side near the stadium. The land was next to a lake, close to the stadium, and a new transportation hub with railways and bus facilities was under development right next door. As they stepped into the land for a quick survey, it started drizzling from nowhere on a bright sunny day, and there formed a giant rainbow across the land stretching beyond the lake. This was the first hospital. This was not new or novel. It was a continuation of Bhagawan Sri Sathya Sai Baba's health mission, which was started in 1957. Sri Sathya Sai Sanjeevani International Centre for Child Heart Care and Research, Palwal, Haryana, began in November 2016. The institute at Palwal receives patients not just from the remote parts of the country, but also from neighbouring countries of Bangladesh, Nepal, Sri Lanka, Pakistan, Nigeria, and Afghanistan. The staggering numbers led to a need for understanding congenital heart disease and possible genomic relation. The centre thus houses India's first genomics lab dedicated to congenital heart diseases, with the aim of studying the disease pattern and deciphering a possible cause in order to attempt to strike a balance between disease and cure. Sri Sathya Sai Sanjeevani Centre for Child Heart Care and Training in Pediatric Cardiac Skills was inaugurated in November 2018 in Kharghar, Navi Mumbai, Maharashtra. It was dedicated to child heart care, where all services are provided totally free of cost. The centre shall also focus on training of medical and paramedical professionals through recognized courses in pediatric cardiac skills, thereby contributing to this scarce skill set.
व्यवस्थाएं विकसित हुई, उन सब में सफलता का विश्वास का आंक बहुत ऊंचा है और वे इसकी बहुत बड़ी अमानत है। मुझे विश्वास है ये अस्पताल हर मरीज के लिए सिर्फ आरोग्य धाम नहीं, एक श्रद्धा का केंद्र बनेगा, एक नया विश्वास, नई ऊर्जा का कारण बनेगा।
Sri Sathya Sai Sanjeevani Centre for Child Heart Care and Research was inaugurated in February 2024 in Kondapaka, Siddipet district, Telangana. The establishment of Sanjeevani in this region is a massive step in child heart care, where all services are provided completely free of cost. In addition to providing medical care, the centre also focuses on training medical and paramedical professionals through recognized courses in pediatric cardiac skills, thereby addressing the growing need for expertise in this specialized field.